Hey, this is Doc Yates. I'm a naturopathic doctor, registered acupuncturist, and a kinesiologist, owner of the Yates Naturopathic Clinic, and the founder of the interactive health website, Able Health. And this is the Simply Health Podcast, a show for females where I work to simplify and demystify the secrets of achieving optimal health naturally, based on my own experience in working with thousands of female patients over the past 15 years of my clinical practice. Welcome to Simply Health. Hey, this is Doc Yates on the Simply Health Podcast, and on the podcast today, we want to talk about the changes and the patterns of hormone changes that you will go through perimenopause into menopause. Now, the big thing to realize is that these changes, they can start in your late 30s and they can last 10 years. They could start in your late 40s and they could last a few years. So however long this takes and whenever you start, that can vary, but what I typically see is that this pattern almost always happens. So the first thing you will see, because normally what happens when you go to your doctor and you're asking about perimenopause and menopause, really what they're just checking is menopause, and they're checking have your ovaries failed and has your FSH and LH levels changed. So they're not ever measuring hormones. Whereas what I like to do is I like to measure your hormones so we know how they are changing and shifting and how we can adapt to correct those as you're going through the transition. Because what you need to do at the start of the transition is not the same as what you need to do at the middle of these hormone transitions or at the end. So the first thing that you will see, progesterone starts diving down, and typically estrogen often remains high or is slightly higher than what it should be. And what you'll see for these symptoms is that it'll be signs of like a mild estrogen dominance. You will see weight gain around the middle. With the lowered progesterone, you might see some slight hormone changes with your cycle. Period could be getting heavier. Some more PMS symptoms, more irritability, more anxiety with the lowered progesterone. Those are all the things to watch for in the first stage. That's when you know things are starting to shift in your body. That moves into the second phase. And typically what you see for this is that there's still lowered progesterone. At this point, the estrogen is not elevated. It's in the normal range. Everything's good for that because it's come down. But you'll start to see a few localized symptoms of lowered estrogen or lower estrogen supply. And this is typically what you'll see in terms of dryness or vaginal atrophy. So phase 2 is the same symptoms of the lowered progesterone. If anything, maybe accentuated further. Maybe the sleep disturbances are getting a little bit worse. Maybe you're feeling a little bit more anxious and worried. Then now you're dealing with more problems with dryness and atrophy. Then moves you into the next phase. And this is the phase where you're getting really close to going into full menopause. Your periods have changed a lot. Your progesterone is low, and when you start measuring estrogen, it is also getting low. So now the progesterone is dropped and the estrogen starts to follow behind it. And as I mentioned earlier, this can be 10 years after progesterone starts dropping. This can be just a couple years after. So again, you'll be kind of it's good to know these symptoms, because knowing the symptoms will help you know what to look for and when to test. So with the estrogen dropping, now you start noticing things like night sweats, hot flashes, even more mood changes. You're not usually getting, well, at this point your period may be starting to stop or become very irregular. Maybe you're only getting it every few months. And then at this point you know things that estrogen has also dropped. And really that will maintain. The estrogen will keep dropping into the next phase, in which they're both bottom. If you weren't doing anything about it, estrogen's bottomed out, progesterone is bottomed out, hot flashes, night sweats, sleep disturbances, mood changes, no period at all, full-blown menopause. So the key is to know these different phases, and then you can treat appropriately. So at the first phase, you can do a little bit to increase the progesterone and help your body detoxify any of the excess estrogen. And that's very straightforward to do. In the second phase, you can still keep using some progesterone topically And then you can do something where you're just using, you don't need to necessarily do anything to reduce the excess estrogen breakdown products, but then you can use just tiny amounts of like an E3 vaginal estrogen cream, and that will help maintain and prevent atrophy from the vaginal wall. In the next phase, you'll be adding a little bit of estrogen to the progesterone, usually in a nice balanced form, typically in a topical cream. And then finally, once you're using it, and you're using these creams and you're balancing your hormones, the big adjustment has to do with absorption. So there's always a starting dose. Depending on those levels, as a practitioner, you're always starting with a dose. The difference is that different females, because I always use topical, absorb differently through their skin. So again, you might not have the same dose as, say, if we were talking to one of your friends about this, but what you would be going for is the similar levels when you're testing. Because it doesn't really matter how much you take, it's how much you keep. And if you're putting it on your skin and it's not absorbing in, like if you're absorbing 10% theoretically and someone else is absorbing 30%, then you're going to need to take that much more. So that's how that works. Now, a lot of people are worried, well, I don't want to do any of this because hormones cause cancer. And in the early studies, yes, when they were using synthetic hormones, they were using synthetic estrogens only, taking all of it orally. They weren't testing, and they were just blasting everyone full of estrogen without balancing it with progesterone. There has been documented and it was small. It's a small increase of specific hormone cancers. But when it's corrected and you're balancing it with progesterone, you're not taking oral or synthetic estrogen, the risk doesn't seem to be there. And what they might be showing now is it could actually be reducing. So proper hormone therapy can reduce your risk, plus prevent heart disease, improve your bone health, improve your mental function. So the benefits at this point far outweigh any of the risks because those risks are eliminated. The exception is if you have an estrogen-dependent so say you've been through cancer therapy, and when they did the testing, they found, okay, you have an estrogen-dependent cancer. And these are the cancers where they put you on those drugs for 5 years to completely block your hormones, like tamoxifen. That would be a situation where you wouldn't want to be using the estrogen. And there are a few studies that may be debating this at this point, but at the moment, at the present time, it would be don't use estrogen or any of these hormones if you have estrogen-sensitive breast cancers. Otherwise, the benefits outweigh the risk. So I hope this helps shed some light on the transition and how you can adjust and address your hormones as your body's going through this transition so you can be feeling your best at all times. So I hope this was helpful, and this is Doc Yates signing off. Thanks for tuning in to Simply Health. If you want to learn more about health, check out Able Health. If you want to see some of the other projects that I've been working on in health, business, music, and life, please check out the links below.